The candy your kid ate for Halloween has been illegal in Europe since 2022. The bread sold at the fast food restaurant down the street is banned in Australia and Singapore. The sports drink in your gym bag contains an ingredient so concerning that the European Union linked it to flame retardants and restricted it decades ago. And the US government knew about all of it. That is not a conspiracy theory. That is the documented record of the US Food and Drug Administration, the agency whose entire mandate is to ensure the food supply will not harm you. In 1958, Congress passed the Food Additives Amendment, which required that before any new chemical could enter the American food supply, manufacturers had to demonstrate its safety and obtain FDA approval. Congress carved out one exception: ingredients already in widespread use, such as salt, vinegar, and baking powder. They called this category Generally Recognized as Safe, or GRAS. At the time, the logic was sound. Then, 1997 changed the system fundamentally. Under the revised rules, food companies no longer had to notify the FDA before adding a new chemical to the food supply. They did not have to share safety data. They did not have to wait for government approval. A company could assemble its own panel of scientists it employed or contracted, declare a substance generally recognized as safe, and put it on grocery shelves. The FDA might never find out. Both the FDA and the public are unaware of how many of these ingredients, which are most commonly found in ultra-processed foods, are in our food supply. Jensen Jose, regulatory counsel at the Center for Science in the Public Interest, put it plainly: we don't have a comprehensive list of what chemicals are in our food because a lot of times the FDA doesn't know what's in our food. 766 new food chemicals entered the U.S. market since 2000. 10 formal FDA applications filed in that same period. 98.7% of new chemicals self-declared safe. No independent review. No other developed nation operates this way. Every other major country maintains a government-approved registry. If an ingredient is not on the list, it cannot be used. The European Union operates under the precautionary principle. If credible scientific evidence suggests a substance may cause harm, regulators can restrict or ban it while research continues. The burden of proof falls on the manufacturer. In the United States, a substance is assumed safe unless the government proves otherwise, and proving otherwise takes decades. Red dye number 3 is the clearest example. The FDA approved it for food in 1969. By the 1980s, animal studies had linked it to thyroid tumors in rats. By 1990, that evidence was strong enough that the FDA banned red dye number 3 from cosmetics, from lipstick and skin cream. The same dye remained fully legal in children's candy for the next 35 years. The EU restricted it in food in 1994. The FDA finalized its ban on January 15, 2025, not because new science emerged, but because advocates filed a petition in 2022, California passed a state ban, and members of Congress sent a formal letter. Even then, manufacturers have until January 2027 to reformulate. At long last, the FDA is ending the regulatory paradox of Red 3 being illegal for use in lipstick, but perfectly legal to feed to children in the form of candy. Brominated vegetable oil, BVO, was approved by the FDA in 1977. The EU and Japan banned it years earlier because it contains bromine, the same element found in flame retardants, and accumulates in the body. The FDA revoked BVO's GRAS status in July 2024. According to the USDA's own food database, more than 600 products still contained BVO at the time of that announcement. Potassium bromate has been classified by the International Agency for Research on Cancer as a possible human carcinogen since 1999. It is banned in the UK, Canada, Brazil, India, China, and the EU. California requires cancer warning labels on products containing it. The FDA has asked bakers to voluntarily stop using it. No federal ban has been issued. Azodicarbonamide ADA is used as a dough conditioner in commercial bread and to manufacture yoga mats, shoe soles, and foam rubber. The EU banned it in food in 2005. Singapore banned it. Violations carry a fine of up to $450,000 and imprisonment of up to 15 years. In the United States, it carries GRAS status. In 2014, the Environmental Working Group found ADA in approximately 500 bread products from major brands. Subway and Wendy's removed it that year after public pressure, not a government order. As of early 2025, it still appeared in certain Arby's breakfast bread. The cost of delay. The trans fat record shows what delay looks like in full. Denmark banned artificial trans fats in 2003. The FDA did not revoke GRAS status for partially hydrogenated oils until 2015, 12 years later, with a compliance deadline eventually extended to 2020. In 2022, a company introduced Terra flour into a packaged food product solely based on its own internal GRAS determination. No FDA review, no public disclosure. Nearly 300 consumers subsequently reported serious health effects, including liver dysfunction and gallbladder removal. The FDA found out after the damage was done. That is the system working exactly as designed since 1997. In the absence of federal movement, states have acted. California's Assembly Bill 418, passed in 2023, banned BVO, potassium bromate, propylparaben, and red dye number 3, following EU positions Europe had held since as early as 1990. As of April 2026, 28 states have active food chemical legislation. The combined population of those states equals nearly 1/3 of the country. $57 million. FDA budget for GRAS reform versus $3.9 trillion in products overseen. 3,000 plus food additives in U.S. supply not fully reviewed by the FDA. 73% of the U.S. food supply classified as ultra-processed. Some federal movement has occurred. In January 2025, the FDA announced it would review 21 food chemicals. HHS Secretary Robert F. Kennedy Jr. ordered the agency to explore revising the GRAS rule. The FDA's fiscal year 2027 budget request includes $57 million for initiatives that include closing the GRAS loophole. In February 2026, the FDA ordered a new safety review of BHA, a common preservative, citing carcinogenicity concerns documented for decades. $57 million for an agency overseeing $3.9 trillion in products to begin reviewing a framework generating documented failures since 1997. The same Skittles sold in France contain different ingredients than those sold in Ohio. The same sports drinks, the same commercial bread, reformulated for European consumers because European regulators required proof of safety before approval. The United States chose the opposite. For nearly 29 years, while evidence mounted and states filled the federal void, the structure did not change. No agency is accepting responsibility. The companies say they complied with FDA regulations, and they did. The FDA says it evaluated additives using the best available science, and it did. Children between the ages of 2 and 5, who, according to the FDA's own estimates, consume twice as much red dye number 3 per pound of body weight as the general adult population, continue eating what is legally on the shelves. The record is not ambiguous about what was known and when. What remains open is whether the current round of reviews and budget requests will produce a different outcome.